All right, well, good afternoon. Welcome to the webinar brought to you by Community Health Options. My name is Nate Kupel. I'm pleased to be here and glad that all of you could join us this afternoon for this webinar, which will be focused on how we can build a culture of well-being in the workplace with a focus on mental health. And we're privileged to be here with Patty Sands, who is a licensed clinical social worker. And in just a moment, I'll pass it over to Mike Gendreau at Community Health Options to give a little bit more background and an introduction. But before we do that, just wanted to give a few pieces of housekeeping for the webinar. We'll try for the most part to keep folks muted just to make sure that there's no distracting background noise. And we do encourage you, if you can, to mute your line if you can. But we do want to make sure that there's space for plenty of questions. And so to that end, in the webinar screen to the side, you'll notice that there's a questions box. And at any time throughout the webinar, we encourage you to submit a question to our presenter. What we'll do is towards the end of the webinar, we'll pause and we'll review some of those questions with Patty, and she can answer them for you and answer any others that might pop up at the time. And also we'll open the phone lines then as well in case any of you would prefer to say your questions versus type them. But with that said, I'm going to transition things now over to Mike Gendreau. Mike is the Director of Outreach, Education, and Communications at Community Health Options. Just to get us kicked off, Mike.
Thanks, Nate, and welcome everyone to this webinar on a topic that is really important, especially in this day and age. Community Health Options, as many of you may know, is Maine's only local nonprofit health plan, providing health insurance policies to individuals, families, and small and large businesses. If you'd like to know more about Health Options or would be interested in receiving a quote from a member of our business development team, please call us at 207-402-3353. I'd also like to take this opportunity to welcome Patty Sands, our presenter. Patty is a licensed clinical social worker, currently in private practice here in the greater Portland area, where she provides psychotherapy for adults, children, and families in Yarmouth. Patty is formerly the Pathways to Excellence Behavioral Health Director at the Maine Health Management Coalition in Topsom, Maine. And so with that, I'll turn it over to Patty, who can tell you a little bit more about herself and then begin the conversation around this very important topic. Patty?
Thank you, Mike. I'm happy to be here today. Just a little bit more about myself. Before being in private practice and working at the Coalition, I was the implementation coordinator for the Maine Children's Trauma Response Initiative, which was a great opportunity here in Maine. It was a federally funded grant program through National Child Traumatic Stress Network. And we were really able to train an awful lot of clinicians in the state of Maine on evidence-based trauma protocols to help with that very important topic. My sort of deep dive background is in TFCBT, which is trauma-focused cognitive behavioral therapy, and CPP, which is child and parent psychotherapy, both trauma protocols that have been researched and evidence-based now for a long time. I also am happy I do consultation for other therapists as well. And one of the things that is that I've done in my past, which is particularly relevant to this webinar today, is I worked at LL Bean for 10 years in the HR department. And this was prior to an employee assistance program, which is now very robust at LL Bean and in many organizations around the country. And one of the things that we did as HR folks then was we supported and coached supervisors, managers, and leaders on how to be better at their jobs. And what happened was suddenly the referrals to us became of a more serious nature around mental health. And so we decided it was time to form an EAP program at Beans and hired a person that's still there now, Jeff Smith, to head up the EAP program. And it's really a model, very good EAP program in Maine. That is plenty about me. So let's keep going with the webinar. Let's see if I can get the screen to change. There we go. I'm a little too far. So why talk about well-being at all? Well-being has become kind of a more current and sort of hot topic, which puts the focus on a more well-rounded version of a person. So instead of looking at someone's particular diagnosis and whether their their symptoms have subsided, the more important state is how are they doing in life and in general. So just a couple definitions. The Oxford Dictionary says well-being is the state of being comfortable, healthy, or happy. And the World Health Organization, their main point here is that it's a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. So what we recognize now that someone could have extreme symptom reduction, be doing a lot better in a particular area, but really their personhood involves how they're doing socially, how's their work life, how are their connections in the world, how are they doing financially, and that all of that adds up to a state of well-being, which is a more holistic and well-rounded version of how to think about how someone is doing in the world. So why talk about it as far as work is concerned? There's a lot of good reasons why well-being is important at work. It makes organizations better places to work, of course, if the people are doing well. But from a business standpoint, people that are doing well at work also do better work. In workplaces that are set up to foster well-being, people tend to be more creative, more loyal, more productive, and perform better in terms of customer satisfaction. So I know that that's a pretty intuitive statement that if people are doing well at work, if their well-being is good, that they're going to do better at work. But I think that gets lost in the shuffle a lot of times, so that if they're doing well, it is also of great benefit to their employers. So in particular, because I'm a psychotherapist and it's my my way of being in the world, I thought we would take a particular slice of well-being and focus on mental health. And I like Dr. Patel's quote here, "There's no health without mental health. Mental health is too important to be left to the professionals alone, and mental health is everyone's business." If you're not familiar with Dr. Patel, he's a professor of global health and social medicine, as well as a psychiatrist, and he's a professor at Harvard. And both he and the quote from Thomas Insel Next, if you Google either of them, they both have a number of really good TED Talks about these subjects that I encourage you to look at. And Dr. Insel says, "The economic costs of mental illness will be more than cancer, diabetes, and respiratory ailments combined," which I think sort of turns on its head how we tend to think about costs around physical and mental health. The things that I really want to emphasize today is that supporting folks with mental health problems is not just the right thing to do, which of course it is. It's good business. And the key obstacles around getting folks help really comes down to stigma. It's a stigma about coming forward with what the issues are. And one of the reasons that getting help is so important, other than the obvious, is that mental health problems oftentimes are very treatable. especially with early intervention. So the quicker that we can get folks to good help, the quicker that they're going to be able to get better. So here's just 4 pretty common misperceptions and myths about mental health. So the first one, those with mental health conditions do not recover. I remember reading a statistic that I think I saw that 75 to 80% of folks with depression do in fact recover. And I think that we get stuck on hearing about some of the more hard to treat cases and forget that really a large majority of mental health illnesses really are very treatable and people do get better. The second myth, those with mental conditions had bad childhoods or have weak personalities. We know this isn't true, that those 3 things don't correlate at all, that it has nothing really at all to do with weak personalities or bad childhoods. We know that there's a large genetic component that's involved. Right now, there's a lot of neuroscience that's pointing to what happens actually in folks' brains. So it's really important to not categorize people that come forward with mental conditions and say, oh, they must have had a bad childhood or have weak personalities. And that goes right into the whole bucket of stigma and why some folks don't come forward. Third myth, those with mental health conditions cannot work in stressful or demanding jobs. Not at all true. Just like someone with a broken arm can work in stressful or demanding jobs. We really have to remember that we're connected via a neck and that we're one whole human being and that we have a lot of coping mechanisms that can help us work in stressful or demanding jobs. And the fourth one, those with mental health conditions can't work until they're completely recovered. I think what we know now is that there's a whole real spectrum of where you are with particular conditions. And on the road to recovery, you are just as able to be at work and be productive as when you're fully recovered. So just 4 myths to kind of put out there right away. So why should you pay attention to this? I don't really even want to talk about why it's the right thing to do because I think that that's intuitive. But a lot of times I think we don't focus on the business case for why we should pay attention to this, and hard to tease those apart even. But as I said before, treatment works. Symptom reduction for those with common mental health issues can be reduced for 75 to 80%. And a lot of the literature says that mental health problems in the workplace that takes a personal toll on employees and financial cost to companies could really be eased if more people who needed treatment were able to receive it. And the authors of the studies really suggest that employees and employers think of mental health care as an investment and one that's worth the upfront time and cost. And then a few slides here I'll show you some statistics about why that's really true. So according to the National Alliance of Healthcare Purchaser Coalitions, 1 in 5 American adults has a mental illness. I don't think anyone really that I know doesn't know someone in their family or in their circle of friends that's been touched by this if they haven't been themselves. It's just a very, very common. We may not know, though, that mental illness is the leading cause of disability worldwide, and that 1 in 10 full-time employees has an addiction. I thought that was a particularly shocking statistic, but makes sense. 40% of employees with mental illness take time off as a result up to 10 days a year. And I have to say that 10 days a year seems low to me. And this is a really big deal. 35% of managers or supervisors feel they receive no formal support or resources to know what to do to help their employees. And one of the things we'll talk about later is how, if you are a supervisor or a leader in an organization, how you can come forward and really ask for that support and ask for that training so you'll be able to support the folks that work for you better. At this point, only 15% of managers and supervisors that were polled are trained to recognize mental health issues and share support and resources. And altogether, all the statistics that I'm going to mention in the webinar today are likely underreported. And the reason for that is because there is such a stigma that oftentimes people will stay silent and not talk about what's going on for them. So more about the business case. It's broken down really into three main costs. And absenteeism is the first. Presenteeism is one of these new words that sort of comes along in business that really talks about illness-related reduction in work productivity. So while you are at work, are you actually doing the work that you need to be doing? Are you able to be as productive as you can? Or are you, as we've all been at various times in work and at organizations, just there in your body, but not really there in your mind, phoning it in? And the third sort of bucket is turnover and the huge costs associated with having to replace employees that have to leave. So absenteeism, just to look at that for a minute. What you'll notice through the presentation today is that a lot of the statistics are really come under the bucket of depression, and that leaves out a whole host of mental illnesses. But I think it's because there has been the most research on depression. So because of that, we've got the most statistics. So according to the National Institute of Mental Health, the leading cause of absenteeism in the United States is depression. And certainly it can lead to substance abuse if folks turn to drugs to self-medicate. And as of 2013, depression costs in the US cost $23 billion. And I can only imagine that it's gone up from there between 2013 and now. And of course, just to point out that those statistics have to do with depression and don't include other diagnoses. So we're talking huge costs to organizations. So presenteeism, which is, again, the performance of workers who are present at work. And what it talks about is it's not about necessarily the problem of workers being on the job, but because of illness or other medical conditions, not fully functioning. And not fully functioning can cut individual productivity by 1/3 or more. And what we're finding is that presenteeism, as opposed to being absent, is actually a costlier problem than not being there altogether, because I imagine most people are likely to come into work more often and are not fully there. And unlike absenteeism, presenteeism isn't always apparent. You know when someone doesn't show up for work, but you often can't tell when or how much illness or a medical condition is hindering someone's performance. People get very good at hiding that. And it just really looks like we're there in body, but we're not there in mind. My slide's doing a little funny thing here. Hold on.
Patty, currently it's on the Presenteeism Continued slide, in case there's a technical thing there.
Oh,
now it's on the
okay.
Presenteeism slide. Yep.
I want to be on the very next one, and there's a lag for me.
Well, right now we're on the Presenteeism.
And I'd like to get to slide 12, but it's not letting me forward. I apologize.
Let me see. Let me try advancing it for you here.
Okay, thanks.
Okay, now it looks to be on the Presenteeism Continued slide. Is that on your screen now as well?
No, I'm seeing slide 11, but that's okay. Now we're on 14.
Okay, let me see if we can go back here. Now it's on the turnover slide. You want to go back one then, right?
Yeah, one before that.
Okay, now it's on the Presenteeism Continued.
Okay, thanks. So this just backs up the other things that we were talking about about presenteeism, that it's a particularly large drain. It eats up 77% of MDD, major depressive disorder, workplace spending, and 37% of the overall $210.5 billion. And presenteeism costs increased from 21.5 from 64.7 billion in 2005 to 78.7 billion in 2010. So it just keeps going up. So I'll try advancing it, Nate, and see. There we go. Good, thanks. And turnover, everyone that's in the HR world knows the cost of turnover. But Ernst & Young reports the cost of losing and replacing an employee may be as high as 150% of the departing employee's annual salary. And that includes the manager's time training new employees, as well as hiring a new person to take over. So really a big case for getting folks to treatment, having them be present while they are at work, and also not finally having to leave. So now let's bring it down a little bit to what can we do sort of as individuals in organizations. And before I talk about any of these points, I'd love to just give sort of an introduction about your culture better than anyone else. And you know what's being done already. And you probably know how much or how little you can push the environment forward in the things that I'm going to suggest. So keep your particular culture in mind within your organization as we mention the things that or suggestions that you can do. So building trust. As a supervisor or leader, create a culture where mental health illness isn't stigmatized and seeking help is encouraged. And we'll talk on the next page a little bit about how you can do that. If you do have an employee assistance program available, very often the EAP folks have free resources. They can train or do management consulting for managers and leaders. And then promoting the use of EAP programs and mentioning them and having them on having access to EAP on bulletin boards is critical. Once again, just reiterating that early intervention and getting people help quickly is key. Remind your employees all the time about these resources for staying healthy and productive. And remind them that access to EAP is confidential. And do it in multiple ways and throughout the year, especially at times of stress such as the holidays. This would be a great time to do an extra push on the resources that you have available as an organization. You want to integrate mental health educational messages in health communication strategies. So again, remember that we're connected by a neck that we can talk about mental health and physical health in one place. And that can be in company newsletters, on the internet, and other regular employee communication platforms. Listening to your staff sounds so simple, but it goes such a long way towards employees' well-being at work. Listen to what your folks have to say. Show them respect, support, and concern for their welfare. A little goes a long way for expressing appreciation for employees' work well done. See if you can educate employees and managers about mental health issues, including depression, and encourage employees to seek care when they need it and as soon as possible. If you don't have a way to get education, begin to start asking the questions about what can be brought in at work. Talk with leadership, talk with upper management, and find out what they're willing to do in this area. To the degree that you can reduce stress within jobs and workplace, find out if people are feeling stressed on the job, and see what you can do to rework their jobs to make them less stressful. We know that physical activity goes a huge way to mitigating particularly issues with depression, but definitely other mental health problems as well. So if you can lead as a supervisor or manager by example and take the breaks that you need during work to do physical activity, this will give permission to the folks that work for you to do the same. And understand the medical model of mental health. I find this is a really important point. Dr. Insel, who we talked about earlier, doesn't even like using the words mental health problems. And he says, would you call cancer a cell cycle problem? And of course you wouldn't. Does a tumor define a person, or is it a person with a tumor? So very often you'll hear someone who doesn't know better saying someone with schizophrenia, they'll say, oh, he's a schizophrenic. Well, words are important and language is important, and how we refer to folks with physical illnesses and mental illnesses is very important. So if you think of mental health in the medical terms, so under the category of someone with pneumonia or the flu or broken wrist, we know that those things don't define a person, nor does mental illness define a person. And it's really important to think about it in those terms. So now we're going to talk about depression, pulling out one particular diagnosis, just because, as I said, it's the most studied and most referred to as the costliest in the United States. So depression, even the most severe cases, can be treated, and the earlier it's treated, the more effective it is. Most adults see an improvement in their symptoms when treated with both an antidepressant and talk therapy. There's most evidence that both is really, really effective. One or the other is certainly effective, but both is the ideal. Costs a lot of money. Nearly half of depression costs are attributed to the workplace, including absenteeism, missed days from work, presenteeism. And whereas 45 to 47% are due to the direct medical costs, which are things like outpatient and inpatient medical services and pharmacy costs. About 5% of total expenditures about depression are related to suicide, another reason for early intervention. Mental and physical conditions aren't mutually exclusive and often co-occur. And employees with depression have a 20 to 40% they're more likely to become unemployed. So they have a 15% job loss rate versus 3.5%. And I know that I'm in some ways repeating myself on these slides, but I think it's important to repeat and to hear it, that business productivity is hugely impacted by depression, even more so than physical disorders, and that stigma and negative stereotypes are the single greatest barriers to treating mental illness and lowering costs. And what we know is that nationally, 1 in 8 workers have been diagnosed with depression, yielding tens of millions in the workforce who have either grappled with emotional health issues in the past or do so today. And there's discrepancy, 1 in 5, 1 in 8, but the idea is that just look around the room and you will have, you'll know someone who's been diagnosed with depression. It's pretty amazing. So as opposed to what can you do, taking it up sort of more of a global look at this, what can your organization do? The stigma piece is huge. Create awareness, encouraging acceptance and challenging false beliefs. Break the silence around mental illness and educating employees. And using the right language like we talked about when talking about mental illness. Seeing the whole person as a person and not just their condition. I know that NAMI, which under the resource pages at the end, has a whole workplace support initiative that can help your organization decrease stigma. So I would really encourage you to go on the web page for NAMI and find out what their supports are for decreasing stigma about mental illness in the workplace. I also was for a while on a bi-monthly committee through an organization called Maine Quality Counts out of Augusta. And they have a work committee that meets bi-monthly. And right now, this year is focusing entirely on reducing stigma, particularly around substance abuse in the workplace. And if you would like to contact someone about that committee at Maine Quality Counts, the person to contact is Liz Miller. So reduce stigma is a huge obstacle, or stigma is a huge obstacle, and reducing it can go a long way. Continue to be supportive and inclusive. Provide access to EAPs. Work with your insurance carrier about adequate mental health coverage. We do have a parity law, which means that mental illness and physical illness are required to be treated equally under our insurance. Just check in with the folks in HR and make sure that that's the case. And certainly bringing in an expert to your organization on mental health can be a really nice way of normalizing the conversation. This is one of my favorites. High-profile leaders and influencers talking openly about their own mental health issues or ones within their own family can go a huge way to normalize the conversation for everyone else. And there are some organizations that are making a point to ask their leaders to do that, to talk about their own problems and what they've done to get help. Creating policies which emphasize work-life balance can go a long way to reducing stress. And create policies which support return to work. So if someone does have to go out on a disability, are there real nice, easy ways for folks to come back to work and get reintegrated into the workplace? So I wanted to mention in particular that Kaiser Permanente has been one of the most radical leaders about speaking up about mental illness. And I'm quite sure in the resource page, I put a link to an article about this and how far leaders speaking up about mental illness has gone to allow employees to get help when they need to. Certainly, we do have a lot more good screening tools available for depression. The PHQ-9 is one that's being used an awful lot all over the state. And what's great about the PHQ-9, well, there's lots great about it, but it's a free screening tool. That's one thing. But it's also will screen for depression, but it's also been found reliable and valid for assessing for depression. So if you were to screen positive for depression, 3 or 4 months later, you could take it again and find out if your symptoms are coming down. So that's a really positive step. And then be relentless regarding ways to reduce stigma in your organization. If you see that it's a problem, ask those around you in leadership positions. Say it's important to you to find ways to reduce it. And you can certainly give the business case. I hope you've gotten some statistics from this webinar about why it's important. Not just the right thing to do, but actually make the business case for why it's an important thing to do. Just a few things that are shifting in Maine. There's an awful lot of primary care docs here in Maine that now have a behavioral health therapist integrated right into the office in their primary care. So that what we know is that primary care docs are often the first line of detection for folks with mental health issues. So they might talk with their primary care person before anyone else. And having a mental health therapist right in the office, it can really go a long way to just a warm handoff of a primary care doc say, here, I have someone that you might like to talk to who's right in the office. And this is becoming more and more commonplace, and I think is a really exciting development in Maine. There's an increase of telehealth, which is a really positive step for rural communities where we know there are not enough in-person therapists and particularly psychiatrists. And psychiatrists have gotten very involved in telehealth and making it accessible for folks in rural parts of the state. More and more in the world of behavioral mental health, we're seeing an emphasis put on evidence-based protocols. And that's a real shift in the world of mental health. We didn't used to have that same sort of high bar, but now there are protocols that we know work for particular diagnoses. They've been proven, they've been researched, they're tried and true. And people can do some of their own research when they're seeking a therapist to find out what have they been trained in. Are they certified in a particular protocol for a particular diagnosis? How long is the therapy supposed to last? What can you expect for getting better? And just being a better consumer as far as their own well-being when it comes to seeking a therapist. And the Maine Wellness Collaborative, which was formerly known as the Lifeline Wellness Collaborative, has been reconvening. And Nate, are you able to talk about this just a little bit?
Yeah, sure. I'll give a quick little overview. What the Maine Wellness Collaborative is a collaborative organization of various employers throughout the state, really focusing on looking at wellness work in the workplace and the impact of good health in the workplace. And they provide a lot of various informational, educational, and benchmarking resources for companies looking to engage a little bit more with others about what's going on in the workforce around wellness work. And I do know that this was mental health was something that has been kind of at the forefront lately. So we're happy to send out more information about that, or you can reach out to me, and I'm happy to connect you with them as well.
Thank you. Well, thank you for listening today, and we've got a few minutes left to take any questions that you might have, or any that came in, Nate.
Yeah, and again, just for those of you who want to submit their questions now that we're at the conclusion here, please feel free to use the questions box off to the side of your screen. There, you can type them in and send them off, and I've already seen a couple that have been coming in just a few minutes ago. So feel free to shoot those over in the question box, and I'd be happy to read those out for you. You can also raise your hand if you want in the webinar platform, and if you prefer to just speak up, we can call on you and you can speak up if you like. But I'm just going to start with a couple that I've seen that just came in, Patty, for you. One of them, here's one of the questions is, we're a small company of around 9 employees and several who are remote employees. What are some ways that we can build mental health into our organization for a blended workplace like ours?
Oh, that's a great question. I know of a number of small organizations that have formed wellness committees, and with very, very little money have been able to do some really exciting things for folks. So that's one thing. Even a small budget can go a long way to helping folks. I don't know if in a small organization sort of what the technical setup is for you, but certainly having folks call in to meetings, having folks be able to access any informational, if you bring in experts on mental health, are they able to call in and participate? And certainly leadership has the same, even in a small organization, the same, if not more, power and weight to talk about their own issues to make it a more normal conversation for people.
Great, thanks. We have a couple other questions coming in here. Thank you for submitting those. This is an easy one. Somebody just asked about the slides being available later today, and the answer is yes. And this webinar is being recorded as well. So we'll send you the link to the video webinar, and you'll be able to look at all of these. It looks like we have a couple questions on in that vein. Let's go to the next one here. Another question. You talked about stigma a little bit earlier. Our organization takes mental health on the job very seriously and do offer additional support and benefits to our staff. But one of our problems is in the larger societal issue that people don't ask for help. How can we be more effective in engaging people with our resources?
Well, I know that some organizations are within their own health screenings are adding a portion on mental health, and there are oftentimes self-reported tests that people can take that would help them figure out sort of how to focus their attention on their own issues. There also can be some sort of connection, confidential connection, and forgive me, I'm not technical, so I don't know how this works, so that someone that might come forward on the health screenings can do so in a confidential manner and get help. So I think that that's a couple of ways that people can begin to self-identify and come forward more.
Great, thanks. Another person asked for if you happen to know of any specific examples of Maine companies or employers who are doing a good job at being inclusive of mental health in the workplace.
Well, I mentioned LL Bean because that's the one that I really know sort of, they have a really robust EAP program, and one that is actually on site but separated from, it's near where folks work but set off so people can go there confidentially if they wish to. My sense is that Bath Ironworks does a really good job. They recently brought in some experts on resources for supervisors around addiction, so that supervisors could be trained if they have an employee that they know needs help with substance abuse. They are very aware of what the resources are in Maine. So those are the two that come to mind for me really quickly.
Great. I have another question. And by the way, thank you everyone for submitting and sending in your questions. Keep them coming. This one is a little bit more sort of on the supervisor level. I mentor a younger employee who's going through some stress at home with their family. I'm not sure how to help since most of the stress is coming from home rather than at work. You mentioned a lot of great systemic ways to engage in mental health in the workplace. How do I get started in having a first conversation with them about taking advantage of some of these resources? It's kind of a tactical, I think, kind of question. Yeah.
Yeah, I think there's a lot there. One of the things that if my memory serves me, is oftentimes EAP programs cover the family members of those in the workplace. So I think bringing up the EAP as a resource is probably the first step towards having a conversation. Also, being able to mention some personal examples, I think, can really help.
Great. And then one other, I think maybe what looks like maybe the final question, and we still have a couple more minutes. If you want to type in a few more questions, you can send them over right now. But another person just wanted to find out how to connect with you if they have follow-up questions. I'm assuming by email or phone. And Patty.
Yes, yeah, we can certainly make my email available after the webinar. That would be fine. Is it best to do it after or to give it out now? What do you think?
You can say it just by phone right now, and then we can follow up as well afterwards.
Okay, my email is pgwynne1@gmail.com. So pgwynne1@gmail.com.
Great. All right. Last call. Any other questions that folks want to get in here before we adjourn for the afternoon? Okay, here's another question, Patty. How can a small company, 20 to 28 employees with little disposable money put an EAP into effect?
Oh, this is not an area of expertise for me, but I believe that there are EAP organizations that price according to size of organization. So if it were me, what I would do is Google EAP programs in Maine and look and see who the sources are, and give a call to a couple of them. I know that maybe it's by employee, the cost by employee. That's making more sense to me, that it's by head, and so might be able to be affordable even with little or few resources.
Yeah, and it looks like there was a follow-up to that same question from the same person about how they have little to no HR support. Little to no HR support from the offsite company owner. I don't know, Nick. I think if you wanted to send another clarification in there, that maybe that would. Oh, the owner has no buy-in. That was the clarification from the same person. Okay.
So what asking then? What do you do if there's no buy-in from the top?
I think so.
Oh, that's a tough one.
Yeah.
I think that that's a tough one. The only thing that I could imagine doing is finding if there are other leaders around that person that might be able to be sympathetic.
Okay, great, thanks. Any other questions that anyone else wants to pose there? We've got a few more minutes just in case there are any other stray questions that you want to fit in there. I'll give it a couple more seconds, and while I'm waiting for any potential questions to come in, Mike, if you're still there, was there anything else that you wanted to add to this, or any questions that you might have from on the community health options side?
Sure, it's not so much a question, but first I want to say thank you to Patty. I think this conversation is very timely, and mental health affects many households here in Maine, and I'm especially grateful for the questions that surfaced today. It does signal to me that there are many organizations out there that are struggling with what's the best way to provide these services to its employees. One of the things that Health Options has done to try to support small and large businesses in these efforts is many of our health plans actually include as a behavioral health benefit the first 3 visits to a behavioral health or substance use disorder professional are at zero cost. So there's zero copay for the first 3 visits, and that's on an annual basis. So it's one way that we've tried to at least reduce the barriers that some people may experience to accessing care. It's modeled in some ways like an EAP program. And also with regard to EAP, just a note that companies who do offer an EAP program, it usually does extend to the family members.
All right, great. Well, thanks, Mike. I don't see any other questions submitted here. So again, just to echo Mike, I want to thank Patty again for taking the time this afternoon to speak with all of us. And once again, this webinar has been recorded and will be made available to you probably within the next week on the website. And we can follow up with additional resources as well as Patty's contact information if you have follow-up questions. But once again, thank you all so much for joining us this afternoon. And we look forward to seeing you in future webinars. Thanks very much. Have a great day, everyone.
Bye.